So, good day, everyone, and welcome, and thank you very much for coming here. It's not the first time, and I appreciate that greatly. And all of you are here. So, I'm Ken Dempsey. I'm a registered nurse who's been in critical care air transport for the Air Force for some years, retired, working at the VA now, and I'm a doctoral candidate at Liberty University in the traumatology cognitive counseling, community counseling. That's a great program, and here I am. And again, I thank you. I won't do introductions, and all of your family who have dealt with and are dealing with a member that has had or has PTSD and have been way too familiar with suicide in the family. So we're going to talk about these things, as hard as they are. So I'm going to talk about learning outcomes, and so each person will be able to recognize and analyze 3 symptoms of PTSD. We're not just me standing up here talking. It's going to be interactive. I believe in the interactive. And recognize 2 actions to take when faced with potential suicidality and how to de-escalate that sort of thing. Name and assess 2 coping skills. I'm going to talk about them. And know how to implement 3 useful resources. And towards the end, we'll have resources here. So a little bit about PTSD, and I need a volunteer to read that statement up there. Yes, ma'am.
About PTSD, post-traumatic stress disorder is a mental health condition that's triggered by a terrifying event, made by experiencing or by witnessing.
It's important to remember that it's not an abnormal condition. It's a normal reaction to an abnormal situation. It doesn't always have to be military. There's often the little child whose house burned down, and that little girl has experienced PTSD, hasn't she? Mm-hmm. Certainly. We love pets. When we show the film, there's a pet that de-escalates, and it's a great thing. Pets are so soothing and healing. And today, the monarch butterflies have come back on. So 4 clusters of PTSD before I get too sidetracked. Intrusive memories like nightmares, uncontrollable thoughts about the event, flashbacks, and that sort of thing. Characteristic of PTSD. Also, hypervigilance, like you're sitting in the corner with your back to the wall in the restaurant and trying to eat your steak tara or something, and you can't really relax. And I've experienced that myself. Feeling fearful of the future, anxiety, and avoidance behaviors such as social isolation, staying away from other people, limiting interactions, isolating, and people drink and sometimes drugs. The thing to remember about PTSD too is post-traumatic stress becomes a disorder if it lasts more than, let's say, 3 months. They usually give that figure. Treat early and it's better outcome. So we're going to do a think, pair, share after we see this video. It's a great little video. And thank you, Maxwell, for joining us. So the think, pair, share involves 7-minute where each one of you will write something, your thoughts after seeing that video. And it's a video that carries a warning, kind of. It's very powerful. It shows an attempted suicide, but remember, it is an enactment. These are actors, and the outcome is good. So I keep using this for you because I think that's important, because there are people here and people watching, maybe, who have experienced that and could be a trigger. So feel free to leave, walk out, and come back, or whatever you want at any time. So a minute to write, 2 minutes, and you pair off. We have 6 people. And then a larger group discussion for about 4 minutes. And that is after we see the video. So this video is about a soldier. You know, we have soldiers, airmen, Marines, Guardians that go to the combat zone. It could be Afghanistan, Iraq. In this case, I believe it is Iraq. The man has come back from Iraq, and he and his wife are separated. They have a little son, and they're both, of course, concerned about him. But the guy is struggling, clearly, and you see that. And it involves a little therapy dog. That's why we love our animals so much. They're wonderful. And so here it is.
It's a tight squeeze. Do me good to spend time with you.
Yeah, but I want you back on the net.
Second chance, not
That's the deal. I want you back in Dr. Holt's meds, and I want you back on your meds until you can do better. Mom, Dad, look what I found! Come here! Oh, can I take it home? Are you tired? I feel dangerous.
I think he's fine.
Hey, please, hold on, hold on, sit here. I know.
We got it. Did you hear that? You're worried about Argentina, Devin. I'm over every day. I can feed it. I kind of feel like it would be better if I could see you guys a little more.
I don't want to have son.
Whatever you got against me, don't take it out on the dog, okay? The
Oh
dog's
my
been through a
God,
lot and
Pete,
deserves
it's
a little
not
bit
just
better, and that's my
about the
birthday
dog.
present to our son.
My son is my priority. You know what? You should be yours too.
Maybe you hear it this time.
Got that? Stay right here. Yeah. Come on, let's go talk to him. I need you to put down the gun, okay? Look at that!
Oh, yeah.
Everybody all right?
Yeah.
It's powerful. It is powerful. Thank you for. I had thought about removing that, and then I put that back in and urging other people. So again, now we're ready for that think pitch here we talked about. So if you would take a minute and write down some of the thoughts, ideas that you have after seeing this question. Take a minute to do that. We're almost there. You're ready to let me know. Want another more time? That's fine. A couple more seconds here. Okay, so if you would pair off, pick whatever partner you want and go ahead and discuss, question, clarify, whatever it is that you might want to.
Shut down the wife. She shouldn't give up on continues. She tried. You don't just. He thought he could manage it himself.
The desperation he felt.
To reach out for help.
Rescue him.
She does not feel that
Cool.
Signs of PTSD. At first, he was like in denial that anything was wrong, thought it was fine, and he didn't want to go get help. And then
Can't
second,
sound good.
something I heard
It's like you're creating like a prison
that
here.
soldier that had been shot.
Maybe create some sort of safety net
Said things like he died for you,
that you can use like
and felt very guilty.
Safety net.
The problem is that it's hard to know when you're
It was very hard
Well, I think
to,
in another respect too, that he died from
yeah.
because he comes back to
the
the
safety
civilian
net. We
world.
have a safety net.
He sees everybody just moving on with their life,
A sign.
and they don't understand what he's been through. They will never get it. They don't understand.
Maybe they don't have any idea. Maybe he hasn't told
Right.
them
But
what
he,
happened.
I think he kind of resents it too. He went through all this hell, and everybody's clueless.
Parking lot.
Right.
Very big key, right?
Saw.
That's great. You took extra time preparing off of it. Whenever you're ready to get into the bigger discussion. If you want to talk singly, that's fine. Otherwise,
Oh, Max, buddy.
you okay?
He's tired of getting pets.
Non-therapeutic.
You okay?
Spontaneous, folks. I have no control over it. But so, oftentimes that one thing I'll say there is think of the fight and flight response, or freeze. Some people freeze, and that soldiers, sailors, airmen, Marines, Guardians go over. To go to deploy and come back often feel that they come back and all of those skills that they learned need in Iraq, Afghanistan are not needed back here in Boston or Miami. And so, but it doesn't just automatically go away. So I'd like you guys to go ahead and talk as I show this here. Hopefully you can see it. It's an up escalator, and there's a brain, frazzled brain, going down the up escalator, and on the up step parts of it are words like panic, shame, set, and so at this time, maybe what we can do is remember that a lot of these feelings are felt by not only the soldier, and I use that generically, soldier, any military member that has deployed and come back, but family members, and the emphasis here is on the family, who are often overlooked, not given adequate support, and I've seen that, and you have seen that, and you can talk about that, but I need a volunteer for the great writing board over here to list some of the symptoms of PTSD. So some of the symptoms, and that's in keeping with our objectives, our learning outcomes. A few symptoms of PTSD. There's clues here.
I noticed that he had a lot of guilt
Yes.
because the soldier that kept popping up in his mind that had
Right.
been shot said, "We died for you." He actually said that to the soldier. So I thought he was guilty.
Feel guilt, absolutely. Guilt. Anybody else? Some of the symptoms in the PTSD. Depression. Depression. Yes. So that's survivor's guilt right there. And depression? Absolutely. Anybody else?
He seems very stressed.
Stress. Stress.
Over the
Absolutely.
littlest sounds and things that stirred him in the environment. Kind of made it part of his war thinking, being in his mind. He was back in the war and muffled noise.
Flashbacks.
Yeah, flashback,
Sometimes
slightest
the
little
sounds.
noise
Like,
made him
flying.
go back
Sounds,
there.
smells,
Yeah.
sights, places, you know. And there's the avoidance, the stress, yeah.
Heightened sensitive, always alert.
Always a little hyper alert.
Hypersensitive.
Be like
Hypervigilant is a
hypervigilant.
good way
out
of
of his chair.
term.
Yeah.
Yeah,
Hypervigilant.
absolutely.
That's what I was looking for.
Brilliant.
And the memories were so intrusive to him. You could see it just took over his being.
He was sitting in a, and I can identify with that, in a restaurant, and every slight noise reminds him of something else, and he thinks something else is happening. Meanwhile, he's replaying that tape in his head about that battle that he hasn't processed, right? He hasn't talked to anybody. Look, in a few minutes, we'll talk about some of the therapies that are available.
I think that's the hardest things for them to open up and to ever reveal what they do.
Right.
Ever. To anyone. They'll just keep it locked down.
There's different ways, and sometimes it's a chaplain. A lot of people turn to a chaplain. That's where it first comes out. The VA, and I work at the VA, and we have resources there. And my feeling is there's not enough for the family of the VA. They really have to increase their participation for families. The vet centers are outside the VA, and they do family therapy. Family therapy is so important, and I can say that we can use
Family therapy and education.
education.
So that they can better cope with what the sponsor is going through.
Like the wife and the boy.
It's like if they don't know what's
important.
going
They're not
on,
sick,
and
yeah.
familiar with what he's going through, it will probably just add to his pain because they'll probably just wind up separating. How can you keep the family together by educating them
Educating, yeah.
and letting them know about what he's going through? They may see the outward demonstration of what he's going through, but they don't really know what he's going through.
Yeah, like did he even tell them that he's having these flashbacks?
Like,
That can
Oh,
take
yeah.
years to process.
Yeah, they
Without
don't have any
help.
clue what's happening
There was
in his mind.
noises that we heard last night. It sounded like gunshots. Several of us reacted to that. And it sounded like somebody with a submachine gun, and there were world events here in Florida and Pensacola where they were shooting, and one in Miami, and there was something else, and it was timing was such. It was Pearl Harbor Day that somebody was doing ill-conceived celebration with fireworks without telling anyone else about it in December. But that triggered people. I can tell you that triggered people.
Pearl Harbor Day.
It sounds like guns. It sounds like
It sounds like
automatic
rapid
weapons.
gunfire.
You never
Along
know.
with the high-powered rifle.
Often, if you go into
With a mall down the street.
with a mall,
Yeah,
right?
yeah. So you don't
Think of
know.
all the mall shootings, right?
I mean, society's a little hyper-vigilant right now.
Yeah.
So the dog served a purpose there, and it was like coincidental. That was a drama. They rescued a dog. In the end, the dog rescued the man, didn't it?
Yeah.
So if he
Yeah.
hadn't, I don't know what would have happened.
that was very powerful.
Very
Yeah.
powerful.
That we underestimate sometimes the power of animals in somebody's life. I mean, just like even Maxwell over here before, and petting him, it calms everybody. So the dog just calmed him by licking him.
Yeah, without words. Or
Without words,
anything.
nothing.
And then and then just like that, Maxwell switched
Yeah.
and attacked.
Yeah.
Kind of
We
symbolic.
can talk about cat PTSD as well.
Really? Cats with PTSD.
if you encounter somebody, a family member or a friend or a person on the street, like those people in the restaurant, they remain calm. And the wife later on tried to remain calm, but also maintain the eye contact. I'll let somebody read these points here, what to do, and this is one of our learning objectives too. How to de-escalate, right? Maintain eye contact.
Act with confidence.
Act with confidence, and, as you're trying to help that person in need, distressed person.
Not argue.
Don't argue. Use use open body language versus going like this at them, more like this. Come on, it's gonna be okay. That sort of thing, right?
Use supportive, encouraging comments.
Right. What would think of something?
It's gonna be okay.
I'm here
Everything's
for you.
okay.
We can get through it together.
It's we're in this together. Yeah, perfect. There are resources there if we can get you there. You know, it's never so desperate that you should take your life.
Be honest. There are no quick solutions, but real help is readily available.
And yes, absolutely. So some of the recovery resources. So there's a lot of material in there. And anybody want to bring anything else up? I think the movie might have stimulated your thoughts about that. It was easy to say that the wife was misunderstanding. She was like, I don't want to use the word harsh,
Hard.
Yeah.
but
Oh,
she was protective of the son, wasn't she?
Yeah.
that's understandable.
And his
But that's still his
actions.
father. And
Right.
they have to get it through. Yeah, they have to get through it somehow together. That's his father. That wouldn't change.
Well, she brought up that the wife was kind of already fed up and giving out ultimatums in a way, so she was already past being supportive. So clearly, they needed help even earlier than this.
Which brings the point
Couples
of family health.
therapy.
Right.
It's very important from the very beginning
Right. Before you're
when they come
done.
home, you know, even
Yeah.
before they come home to prepare
Yeah.
for, even in lectures and things that the family can go to learn about it and
Right.
know what to anticipate when their loved one comes home.
Right.
Because the soldier doesn't often talk about it,
They have
which is
debriefing.
a problem.
They have debrief, but it's not enough. I agree. It has to be more to include the family. Oftentimes, the airman or soldier comes back and family meets up. They have some weeks off. They'll go to a Disney World. There's what is that called there? The green space at Disney for military families. They have these yellow ribbon events.
Yeah.
Yeah.
It's a de-escalation. It's a coming back to
Like reintegration.
reintegration is the word. Reintegration is so difficult, but they try to make it. But more needs to be done by the military and by the VA, in my opinion. So some recovery resources. Did you read that?
Counseling, family, group, and individual counseling.
That's one of our learning outcomes too, right? And
Nutrition and naturopathic, healthy diet and quality foods.
also
And sleep hygiene.
that's the hygiene. So oftentimes, if the person can get a good night's sleep regularly, that'll lead to de-escalation. Maybe it means taking a natural, what am I trying to say?
Melatonin.
Melatonin, or something more than that.
Sleep is so important. If without sleep, people become agitated easier,
Right.
and their thinking is skewed. So sleep
That's
is so
right.
important.
Yeah, there are
Sleep is
actually studies that say that if you don't sleep, you actually become less empathetic.
Less
Oh, wow.
empathetic. If you don't sleep, become less empathetic.
That's
So you're
fascinating.
That's a good
Yeah,
point.
cranky.
If you got enough sleep, you're cranky.
Yeah, you can't talk
Yeah,
to people
yeah,
as easily.
yeah.
What about
I'm sure everybody can relate to that.
We
It's
know
like
about
being hungry and
medication,
angry.
but what about meditation?
Meditation's really good.
Music, yoga.
Really
There are so
good.
many
Yes.
things.
I do yoga and I love yoga.
Yoga's
Yeah,
good.
practicing
Meditation.
mindfulness.
Yeah.
Mindfulness is a big term.
Mindfulness.
Yeah.
Put that in there. Absolutely. Absolutely. And what kind of professional help? So, psychologists, psychiatrists, we have social workers who do group therapy, psychoeducators like me who educate the families in getting to know
Social workers.
how to. We have a social worker, a nurse, all sorts of people. We have students. And so,
So
yeah.
important for them to be able to talk to somebody,
talk to
whether
someone.
it's any one of those three or four feels that
Could
they
be a
feel
minister.
comfortable with somebody to talk to them about it.
Out in the community. It could be a minister, a priest,
Sure.
a rabbi, imam.
What about going to your local VFW
VFW, yes,
and just hanging out with the guys? And
absolutely.
anything.
The only
Like a peer.
caveat there is
Peer
that
support.
there's a lot of alcohol, but we have to work through that. And we have actually some outreaches for veterans that meet at a VFW in a room which is a non-alcohol room.
That's nice.
A lot of these places push the beer.
That's
And,
uncomfortable if you're going through like AA or something like that.
right.
Yeah.
What it would
People
be.
walk.
Yeah.
So you have to walk that balance, and some people it's right, some people it is not. So we have the do it the natural way. Look for counseling early. I mean, we believe in it. I believe in counseling, or I wouldn't be in this position. I'm in here. I've been on both sides of it, so I'm going to add here some video resources that well, you'll have the PowerPoint, and there's some good videos here, the whiteboard video series, and I'm going to actually show this in a couple of minutes here, and some other things that we have. And we mentioned CPT, this cognitive processing therapy, where they work on thought. You have the way you react to something that happened, and they try to change how you think about that. And it's a very good therapy. It's successful for a lot. Prolonged exposure therapy, I can tell you, it works. And so you take, you will not relive an incident, but you'll talk in a quiet area with your therapist or your social worker or even minister maybe about the incident that was most stressful to you, causing the most stress. You'll talk about it in a safe environment, and then you'll record it. You'll take it home and listen to it daily for several weeks, and it kind of de-escalates for you, makes it easier for you. And I am going to at this time show a video on full screen here. And what is PTSD? And this is very effective.
Have you or someone you love ever been in a tornado or car accident, experienced sexual or physical abuse, served in a war zone? Most people have been through some kind of life-threatening or traumatic event, and it's common to have stress-related reactions after a trauma. But when symptoms last more than 3 months and they're not getting better, it's time to get help. Meet Sam. He recently returned from serving in Iraq. For many people, being in a crowded place like a baseball stadium or a busy grocery store feels comfortable, but not for Sam. What should be a nice night out, taking his wife Tara to a restaurant, isn't fun for him anymore. He can only handle it if he sits with his back to the wall where he has a good view of the exits, and even then, he's too on edge to really enjoy it. At home, things aren't the way they used to be either. His sleep is restless at best, and some nights Tara isn't sure if Sam comes to bed at all. Sam seems to have a short fuse these days, and sometimes he snaps at Tara over tiny misunderstandings. What he and Tara never talk about is the trauma he experienced when he was deployed. He's never mentioned the guilt, the weight he carries around, wishing he could have done more to prevent what happened. Instead, he's turned inward, pulling away from family and friends. Tara tried to give him some space, but after months passing without change, she really started to worry. She was the one to finally say what they were both thinking. It's time to get help. That's when Sam finally decided to take action. He reached out to a doctor who told him about PTSD, or post-traumatic stress disorder. Sam's symptoms were getting in the way of enjoying his life. Re-experiencing, hyperarousal, feeling worse about yourself or the world, and avoidance are the 4 types of symptoms people with PTSD have. Sam's doctor explained each. The first is reliving the event, or re-experiencing. This is often an unwanted memory or even a flashback where you feel like you're right back in the situation again. Seeing, hearing, or even smelling something that reminds you of the trauma can trigger these. Nightmares where you relive parts of the event in your sleep are common too. The second is avoidance. Staying away from situations that remind you of the trauma. That's why Sam tries to avoid thinking about painful memories altogether. He pours himself into his work or uses alcohol to keep his mind from going back to the trauma. The third is feeling worse about yourself or the world since the trauma. You might feel overwhelming guilt, like Sam, or not trust anyone. You just might not be able to feel happy, even when you are around people you love. The fourth type of symptom is sudden rushes of anger, irritability, feeling jittery, always on alert, always on the lookout for danger. This is called hyperarousal, and loud noises or a driver cutting in front of you can be all it takes to set you off. If you recognize any of these symptoms of PTSD in yourself or someone you love, don't wait. See your doctor to find out if it could be PTSD. Just like Sam and Tara found, there is hope. You don't have to live with the symptoms of PTSD forever. Effective treatments are available. To learn more about PTSD or how to get help, visit the National Center for PTSD website at www.ptsd.va.gov.
Okay. Well, that wraps up a lot of what we were talking about. Let me bring this back up. And again, you'll have a list of resources here, resources available. And I just want to end it by saying that help is available. With God, all things are possible. So we take care of each other, and we should. Thank you very much for coming. Thank you so much for participating.
Thank you.